And a cancer prevention and control program with emphasis on exposures to carcinogens, a screening, and a cancer registry is being proposed by the BVI Health Services Authority in partnership with private healthcare providers in the territory.
One thing we're looking at now is a cancer prevention and control program, looking at screening services and screening capabilities, even developing a tumor register or cancer registry, and looking at the numbers of cancer and documenting it throughout the BVI. And of course, our partnership and affiliation with nationally accredited facilities. They've done it well. They're successful at it. Lessons learned, so we don't have to reinvent the wheels.
Carty Baptiste's remarks came during a brunch meeting with the media. Minister responsible for health, Ronnie Skelton, raised concerns about the high rate of cancers and other non-communicable diseases in the BVI while speaking at the government's fourth on-the-road meeting in Virgin Gorda. The health minister called on residents to take their health seriously.
Chronic non-communicable diseases are the leading causes of death among our people. And the health experts have told us that these diseases develop over time from a lifestyle process and not from any one particular indulgence. The common risk factors for conditions such as hypertension, cancers, heart disease, strokes, and diabetes include behaviors that we can change, such as reducing the harmful use of alcohol, unhealthy diet, lack of physical activity. Then there are those diseases that are spread from person to person and have a greater chance of transmission if the person being attacked has a depleted immune system. Just as these diseases develop from a combination of factors, we must also take a holistic approach to maintaining our wellness. And if we do become sick, we must have access to affordable, high-quality health care, regardless of our ability to pay. It is for these reasons your Ministry of Health and Social Development has pursued a holistic national health strategy for our people. The components of this comprehensive approach includes a strategy for prevention of chronic diseases that includes healthy public policy across all sectors such as education, agriculture, infrastructure, and trade, coupled with a social marketing plan that will assist with this implementation.
Director of National Social Marketing Centre in the UK, Patrick Ladbury, was commissioned earlier this year by government to develop a social marketing plan to introduce behavioral change practices among BVI residents in order to reduce the rising numbers of chronic non-communicable diseases. A 2008 report by the Organization of Eastern Caribbean States United Nations Development Programme has identified chronic non-communicable diseases such as diabetes, hypertension, and obesity, along with depression and substance abuse, as major health problems facing the BVI. The report also says that in 2004, the top 3 causes of death in the BVI were cancers, hypertensive disorders, and coronary artery disease.